Caulfield Health Centre. Can I help?
You're looking very down.
Yeah.
Tell me about that.
It's just, everything's just getting to me at the moment.
This is a cyst, and Dr. Lee said she didn't want to cut it out because it's right on the jugular.
Thinking about trying the Weetabix diet.
The Weetabix diet.
At this point, I have to do something which is fraught with risk.
Oh, hello.
With your medical history, I don't think anyone will want to go near you unless they have to.
Health Centre can help you. Good morning.
Thomas Candricow.
That's me. Thank you for seeing me on such short notice, Doctor.
That's OK. Come on in, have a seat. I'm Dr. Graham. How can I help?
Right, if you look at my history, last year I had this case of a similar situation like this where my mouth lost skin. I couldn't eat very much, but compared to it now, that was like a 3 or 4. This started off again on Tuesday or Wednesday.
Yes.
I have lost skin everywhere. I haven't eaten a solid meal for 4 days.
Yeah.
I went to the pharmacist. They recommended something called codeine with paracetamol.
Yes.
Which the pain has subsided, but even now, here I can still feel that constant throbbing. My head is hurting. But this hasn't happened for over a year now.
Yes.
I don't know what's happened.
OK, and do you have this kind of problem anywhere else on your body?
No.
No. You don't have
else.
any problems, genital ulcers or anything like that?
What do you mean by genital ulcers?
Well, you've got mouth ulcers, that's what these are. They haven't got anything on your penis or anything like that, no.
Nothing at all.
Very rarely there can be a connection when it's quite severe, but it doesn't sound like that's the case.
No.
Can I have a look in your mouth?
Right.
Yeah?
The only thing, Doctor, my mouth probably smells a bit bad.
Don't worry about that.
If you want to probably put on a mask or something, at least it makes me feel a bit better.
No, I'll be fine with that.
Thank you.
Hello. Are you Phoebe?
Yeah.
Very good. Let's give you a chair, Phoebe. Are you going to sit there?
There you go. Ready?
And who's this, Phoebe?
Nancy.
Nancy?
I got some spots.
Do you want to show the doctor where they are?
They're on my belly.
Well, wait a minute. I think I need to ask Mummy a few questions first, and then I'll have a look at your spots in a moment. All right? How long has she had the spots for?
About 4.5 months. And they're only behind the legs here and a couple on the belly, and they look like little skin tags.
She's obviously reasonably well.
She's absolutely
completely
fine. I think she's got a little bit of eczema as well on the back of her legs.
Has she had eczema before?
Never, no. I think the hot weather's brought it out.
OK, we're going to have a look at your spots now, Phoebe. Will you show me your belly first? She's only got one.
She's got a couple on this
Oh, yes,
side.
I
You can
see.
see where she's and they've cleared.
No,
but
there's one. Look, that's a perfect one there.
Yeah.
The other thing is, Mummy wants me to look at your leg. Do you mind standing on the chair? If you just keep a hold on her. Yeah, a little bit. The name for that is molluscum.
Yeah, that's what I couldn't remember.
I'll print off the sheet for you. So it is a virus. And you don't want to do anything with them. Although they all go in the end, they can linger for quite a while.
Yeah, it just feels like
common, harmless. Just try to ignore it.
But is that definitely eczema on the back of her legs there?
I think you'd call that eczema, but I mean, she may have got some spots and picked them and they've got a bit irritated. Let me give you some treatment.
Yeah.
Mild steroid, just for where it's bad. When you've cleared it up, leave it off and wait and watch what's happened. Okay. And if it then comes back, we would adopt a slightly different approach.
Yeah.
Here's some stuff on molluscum. I mean, she's got it very mild. Quite likely she'll get more spots. If she picks them, she'll tend to infect herself, but you can't stop her picking them. So.
Thank you.
Right, Phoebe, are you playing a game?
I need his gloves.
Phoebe, you may have that glove. Special present.
Wow, doctor's glove. Thank you very much.
Closer.
Can you sew it up?
No, that's Mummy's job.
Yeah.
Take the glove and take the book.
What do you say to the doctor, Phoebe?
Can I have some, please?
No! Can I?
very good.
Right, you're going to take your glove.
It's lovely to see you. Bye-bye. Bye-bye.
See his next patient. Thank you.
Goodness, it's quite a lot, aren't there? And then open up wide. Yeah, you've got a lot on the roof of your mouth and on the back of your mouth as well. All right, so most of the time, this is due to a viral infection that we can't really name. But just occasionally, it could be that this is a viral infection called herpes. Have you heard of that?
Isn't that an STD?
It can be an STD, yeah, but it doesn't have to be, OK? And I'm just wondering whether it would be helpful just to rule that out.
Just to run this by you,
Yeah.
because I haven't been actually sexually active for about 8 months because my girlfriend has long-distance relationship.
It's probably nothing to do with sex, this, OK? So there are two sorts of herpes.
Right.
There's genital herpes, and then there's herpes, which is just like really bad cold sores.
Right.
Okay? And that is probably all it is, but it's really bad. So I think we need to
Do something.
investigate it a bit more. Okay, it's a little bit of a rough swab, so it makes it a bit sore. I'm sorry.
No, as long as it helps you find out what's wrong,
Yeah.
I'm cool with it.
If you could lower your lips down, I'm just going to do it along here. You've got quite a few examples there. OK, that's great. That's done. OK, so that will take a few days to come back. If it's negative, then it hasn't really progressed us as to why this is happening. But some people do get terrible mouth ulcers.
Yeah.
And there isn't very much that helps with mouth ulcers.
I've got 4 gels which I'm constantly using.
The problem is that as soon as you put them on, your mouth washes them away. If over the next week or two it's clearly just getting much worse and you're suffering a lot, then just come back in. OK?
Doctor, thank you very much.
That's all right. Good.
See you later now.
Yeah, bye now.
Michaela Farrell, please.
I'm so sorry I missed it this morning. I wrote down the complete wrong time. Oh, God. Thank you.
How are things?
Yeah, same. How's my x-ray? Same?
They're normal.
Yeah, I thought so. The tablets aren't doing anything. I really kept on with them and the side effects were fine. They went down.
The pregabalin?
Yes.
Yes, yeah.
And it's just still got this bloat and then this twisty kind of pain. I don't know what to do.
And how often does the pain come?
It's always there, just hanging around in this little patch. Like, I just don't know what to do now. Last week's been quite bad.
Right.
I haven't really slept.
What do you want to do you think?
I don't know. I did some kind of... I know there might not be... Sorry. Oh, God's sake. I'm just fed up and I just want this pain to go.
Yeah.
I can't do it anymore.
I mean, do you think the bloating is a big thing?
Yeah, massive. I'm so sick of it. I just look like I'm pregnant sometimes. Like, that's not... I never had this issue before.
Okay.
Something weird is going on. I don't know. Ugh.
We've got GPs, we've got nurses, we've got other clinicians that can prescribe. You ring our number, 24 hours a day, 7 days a week, even when we're closed. We'll send you text reminders on your mobile phone of things that you book in advance. Modern. We are trying to go with it. We're trying to go there. I can't think of anything else. All right?
Thank you.
OK, welcome to the practice.
See you then.
Sean Walker. Hi there, come on,
Hey, how's it going, Mum? Oh, hey. I came here like a few weeks ago because I had like a problem and it felt like there was like a lump in my throat whenever I was trying to breathe in. And I'm not too sure if it's all connected, but like you see last night I basically couldn't get any sleep at all because I've got like this mad stabbing pain here. And then it sometimes can feel like a sensation up here. I got given omeprazole and another thing, and maybe cooled it off a bit. But because like I've run out of that now, it's kind of like starting to get this neck sensation thing again.
So the problems up here have been going on for a few weeks.
Yeah.
Better with the medication to some degree.
Yeah, so like,
and then that's finished.
Yeah, to be honest, it's like last night I had like an episode, I'd say, where it was really at its height and I could really feel it. I guess that's been able to suppress it to some extent, I guess.
Do you smoke?
It's maybe smoke twice at night usually, do you know what I mean? Like, that's it, I don't really smoke during the day.
Alcohol?
I don't really drink that much, to be honest. I'm not really a big drinker at all.
Caffeine?
coffee a lot at work. Like a lot of coffee at work, actually, I guess. So.
Let me examine you. So we're going to start at the top by looking in your throat. Say ah.
Ah. Ah.
It all looks normal in your throat. Now let's lie you on the couch and examine your tummy. If we lift your shit up.
Sometimes, like, when I was lying down last night, I'll just feel, like, a pain there, like, do you know what I mean? And you're moving about. And but, like, even if I move, like, sat up like this, I'd be, like, aware of, like, oh, this kind of...
OK, perfect. So there's a good chance that the two symptoms, the odd feeling up here and the discomfort down here, are interlinked.
Right, yeah.
What most commonly interlinks those two things is stomach acid. So sometimes when you get excessive acid production, it's uncomfortable around where your stomach is.
Yeah.
But also you get acid coming up and irritating your throat, and that can happen while you're awake, but also at night when you're asleep. The medications that you had, one of them was to suppress acid production. I think we should try a slightly longer course of the omeprazole. So rather than 2 a day for a short period, 1 a day for a little longer. Now, while you're doing that, I think a couple of lifestyle changes. We know that caffeine and nicotine are quite irritating to your stomach. Cutting out caffeine and trying to cut out the cigarettes will probably make a difference to the symptoms and allow your stomach to
get healed. Yeah, totally, that's OK. Thank you very much anyway. Thank you very much for your time, man. Cheers. Thank you very much. Cheers, man.
It's important for us to think how many tests we're going to do.
Yeah, of course,
Because I think tests can be quite difficult for you. The more we go through them, they get more invasive as well. And there's more radiation and that sort of thing, which isn't good either.
Michaela is quite a new patient at the practice. She has sadly been suffering with pelvic and abdominal pain for approximately 3 years. She's been investigated quite significantly, but nothing has been found to help us work out the cause of her pain as yet.
You know, I think it's really reassuring that all your bloods were normal.
Yeah, that's good.
And your X-rays are normal, so it's good. There's nothing
There's nothing really bad.
But it's also really frustrating, isn't it, that we can't say, that's it.
Yeah, I know. So, I don't know, what do you do now?
I think what we need to think about is helping you with the pain, really. If we got the pain better controlled.
Definitely.
I'm not saying get rid of it. What our aim would be to manage it better.
OK.
And I wonder if we ask the pain clinic for some help with that.
Yeah.
Because pain is a strange thing. The pain pathways are really tricky, and it's how we feel in ourselves affects the pain, and it's a bit of a vicious circle. You know, if we can feel quite low and stressed due to pain, and then that can make the pain worse as well.
Definitely.
So with the pain clinic, they haven't got any different medicines than what we use, but they look at it in different ways.
Okay.
So what are your bowels like? Have any diarrhoea at all?
No, never have diarrhoea. If anything, it's not like constipated, but like it will usually be every day or every other day I'll go, and then sometimes it will feel like it's not quite out, like I don't know. It just feels heavy and just, I don't know.
OK. Why don't we try some fibre gel?
OK.
Have you tried that before? No. So it's a sachet, it comes, and it's just a fibre that you add to some squash or juice or water. I mean, I still do wonder if it could be an irritable bowel type thing. OK. And it just helps the stool go through a bit more easier.
OK.
OK. I think it's worth trying for a couple of months and see if that helps. Yeah. OK.
Yeah.
There we go. OK. So come and see me in a couple of months to see how you're getting on with this. All right, and I'll refer you for pain clinic in the meantime. All the best. Bye-bye.
How can I help?
It's about my leg. I want to see if anything can be done about the scar. Because it's quite hideous. And all down the back is just hanging there.
Yeah.
How's the sort of numbness in that foot? Is it about the same?
Yes, yeah, I've got no improvement there. It's still numb.
And the operation was back...
December...
15.
15.
Yeah.
Yeah.
So the level of numbness, has it got any better or is it about the same?
It's still the same as when I had it done.
So I don't think that's going to change.
No.
Lorraine has a complex past medical history. At the age of 51, she was diagnosed with a lymphoma. During the course of having chemotherapy, she developed a clot in her right leg. She then went on to develop what's called compartment syndrome and an acute ischemia of the leg. What that means is that the clot expanded and she had to have an emergency procedure called a fasciotomy, whereby you literally slit things down in the leg to release the pressure. And it's an emergency situation, otherwise you're at risk of losing the leg. But you did have a bit of what we call foot drop after the surgery.
Yeah, I still got foot drop, but before I couldn't even lift it up.
No.
You know, I've now got control to...
You seem to be walking more easily than
It's a bit
before.
easier to walk, but I can't walk very far at all.
Well, look, it's got better, hasn't it?
Yeah,
From what you were going through, look how far you've come.
Oh, yeah, I mean, I couldn't even walk in the beginning. Now I can walk a little bit. And, yeah.
When's your next haematology appointment?
Next Friday.
And are they happy with everything that's going on?
Yeah.
They're just monitoring you, aren't they?
Yeah, I go every 4 months now, so...
OK.
I hope just every 4 months, that's all I want.
What are you hoping that they do?
I'm just
improve the appearance.
Yeah, because all this flesh here is just so loose.
Yeah.
I was wondering if maybe something could be done for it to be brought together, because I don't really want skin grafts after what I went through with the last one.
Do you moisturise the skin?
I do. I use bio oil on it, which they say for scars,
Yeah, and just
they?
general moisturising.
Yeah, I use moisturising creams and I use bio oil on the actual scars.
OK. It's a difficult one, Lorraine, because firstly, this becomes a cosmetic issue.
That's what I was wondering.
Which, secondly, with your medical history and with the tablets that you're on,
yeah,
I don't think anyone will want to go near you unless they have to. I'm being completely honest.
Yeah.
And I'm not sure there's much that can be done there. If you open up other scars, you create scars on top of scars, and it doesn't really help it.
Yeah. I mean, would anybody be prepared to see me to discuss it, do you think? Because it is, I mean, it is ugly, isn't it?
Firstly, on the NHS side of things, we'd have to apply for funding for you to be seen, and I don't think we will get that.
Yeah.
Because I'm not sure that there's much that we can do. On the whole, cosmetic surgery is not funded by the NHS. There are certain exceptional circumstances whereby a committee looks at the evidence provided to make a decision on an individual basis. So, for example, if somebody is suffering from severe emotional and functional impairment as a result of their disfigurement, this may be looked at in a different way. I can discuss it with a colleague of mine.
Yeah.
If you're happy for me to take a picture.
Yeah.
Is that OK?
Yeah, that's fine.
It's nice to see you smiling as well.
Yeah.
You're happier in yourself, I think.
Yeah, oh gosh, I've come a long way.
You have come a
Yeah,
massively
from
long
what
way.
I was, because...
So leave that with me, so to speak. But I can't promise anything.
No, OK, that's fine.
Are we supporting you enough? Do you need any further counselling with what's happened, or you do feel you're happy?
No, I'm OK. I've had loads of counselling. I'm not on antidepressants anymore. I mean, I still get down days. Of course you do, but I think anybody who hadn't been through what I've been through gets down days, don't they? But
I think you're
on
an
the whole,
inspiration, actually, of how well you've done.
on the whole, I'm not doing too bad. I don't work, obviously, now. I've been retired. I just try and keep myself busy.
OK, we'll leave it at that for today, if that's OK.
OK, yeah, that's fine.
Nice to see you.
Yeah, and you. Thanks very much. Thank
All right.
you.
Bye-bye for now.
Bye.
Robert Bees, please. Hello there. Hi there.
Hello, all right.
Robert, you're looking uncomfortable.
Yeah, my leg's still playing up and my back. I went to see Sakemead.
Yeah, these are the nerve conduction studies, aren't
Yeah,
they?
they'd done all that and they said they was going to write to me and I haven't heard nothing.
No, OK, I have to say I haven't heard anything either. I'll write to the neurologist and say, look, it looks, you know, this chap's had all his tests done.
Yeah.
They did the electrical test on your arm and your leg,
They've
did
done
they?
it on my arm and my leg, yeah. Oh, just down in the dumps still, really.
Well, you are, aren't you?
Yeah.
Let's talk about that, because that might be more important even than the pains, isn't it? So I saw, since I last saw you, I gather you were evicted from your parents' council house, is that right?
Yeah.
Where are you living now?
I just stay with my sisters.
Yeah.
4 days a week.
Okay.
And then I just stay with my daughters just on the weekend.
So is that the long-term plan, or are you trying to get something else?
I'm trying to get somewhere. I went for a property and they said I was unsuitable.
You're not in work now?
No.
No. How's it working out, staying with your relatives?
Not very good, really. But I've got nowhere else, so just got to do that.
Yeah. And you're looking very down, and you said you feel quite down.
Yeah.
Tell me about that.
Well, it's just the loss of mum still going to me.
Mm.
And my sister and my dad.
Mm.
Just everything's just getting to me at the moment.
How do you fancy draining a cyst behind an ear this afternoon? Yeah. I thought about doing it, but then I thought, oh, it sounds like something Tom might like to do.
What kind of cyst?
A very squidgy one that looks like it might be about to pop. It's probably about that big, very, very squishy.
OK. It would happily stick a needle in it and just see if it'll aspirate.
I think it will probably just aspirate. I think the second you put a needle in it, it's probably just going to go.
Well, that's fine. Book him in, I'll do that.
Debbie Kroll. Hello there. Come on in, have a seat. I'm Dr. Graham.
Hello. This was the last time I think I had a water infection.
Did I?
I think this is a cyst, and I think it's getting infected.
Okay.
It has been once before, and Dr. Lee said she didn't want to cut it out because it's right on the jugular. But over the last few days, it's hurting.
Yeah.
It didn't hurt last time, but it is hurting.
And has it changed as well as being painful? Is it bigger or?
It's bigger and harder, and it feels a bit warm.
Okay.
But I just know it's just... No, I feel a bit sicky, but I don't know if that's just... I don't know. I've got a job interview tomorrow, so I don't know if I feel sick because of that or if it's because of that.
Yeah, OK.
But last time, not at all did it hurt, and it just oozed horrible pussy stuff.
And nothing's come out this time?
No.
OK.
No, so I don't...
Should we just take your temperature first? That's fine, 36.1, so that's normal. Just take your pulse. What's your job interview?
I work in a school anyway as a teaching assistant, and it's in the same school but for a different teaching assistant role.
OK.
So yeah, I'm just a bit nervous. It's ridiculous.
Do you want it?
Yeah. I just think it's horrible when you work there and you have to have an interview with people you know. Yeah.
Difficult, isn't it?
It is horrible.
OK, let's have a look. Just put some gloves on.
OK.
Yeah, it has got a little head on it, hasn't it?
Oh, I don't know, has it? OK.
Little white bit.
Yeah, so maybe it is then, because it doesn't usually have a head on it.
Yeah, that's how big it is. And it's a bit red up there as well.
Yeah. And that is sore when you touch it.
So I don't think you should try and squeeze it.
No, I won't.
Okay?
No, I won't.
And
no.
hopefully it'll get better with some antibiotics, which I think is what we should do. Yeah?
Yeah.
So we normally give 5 days of flucloxacillin, OK?
Yeah.
4 times a day. And if it's obviously getting worse, then you come back. Or if you feel ill, like you're being sick or something. It's basically a sebaceous cyst, which is part of the hair follicle that's got a bit blocked and caused a lump, and then that is prone to getting infected. So it's really common and not anything surprising, to be honest. As this is the second time it's happened, you could discuss with Dr. Lee whether she'd be willing to remove it. But I can see why she's a bit reluctant.
She's a bit anxious about that, I think, and that's fine. I don't want to,
Well, you don't want
it's
things
a bit risky. Yeah.
Exactly. Is that all right?
Yes, of course. That's absolutely
And
lovely.
good luck tomorrow.
Thank you very much.
That's all right.
Fingers crossed.
Yes. Bye-bye now.
Thank you. Bye-bye.
Had you thought about if there's anything I could do to help you?
Well, you give me this letter to ring up about when I was down in the dumps before.
For the get some counselling.
Yeah. They rang me back and said I can go to a meeting.
Yeah.
Which I went there and they was talking to me and everything like that. And they give me the number. They said any time you just ring. So.
I think it would be worth you ringing maybe and asking for some one-to-one counselling.
Pain her now with that lump as well.
Yeah, okay. Let's just stick with your mood for a second because I don't want to lose this opportunity to talk about that really.
Yeah.
So these were the people you rang, wasn't it? Bristol Wellbeing Therapist.
Yeah.
I would encourage you to give them another ring actually.
Right.
That's the number.
Yeah.
And say that you went to a group session before.
Yeah.
That you're very down in the dumps and that maybe some one-to-one counselling would be helpful and they'll take that on for you.
Yeah.
All right. So I'd encourage you to do that. Are you still taking the antidepressant that you were prescribed by my colleague?
Yeah, yeah.
Can I suggest if you've not had side effects, but obviously you are still quite depressed, maybe we should put that dose up to 100 milligrams and see. Okay?
Yeah.
You're probably running out of it fairly soon, actually, aren't you?
Yeah.
So I'm going to give you a higher dose of the antidepressants. So I'll put a prescription for some of that through to the pharmacy next door. You're going to contact those people. I'm going to write to your neurologist. There we go. All right.
Yeah.
I think that's covered enough for today. But I'll come and see me again in a month.
OK, make an appointment for a month's time.
Bye-bye.
Well, thank you.
Francis Pollard, please.
Hello.
Oh, hello. Have a seat. You Dad?
Yes, I am. Who are you, by the way?
Francis, then. I'm Lizzie.
So, I'm here for him, obviously. So he had a bout of vomiting and being generally unwell a couple of weeks ago. And since then, he's had a cough, but only at night. He's had a recurring cough for about a week and a half or so. It was pretty down to sort of recovering a little bit. But then it was a bit during the day, but now it's confined entirely to the night. So
do you think he's had a fever at all then in the last couple of weeks?
No, not since he stopped vomiting.
So, has he had a snotty nose?
Yeah.
Can we take your temperature? Can we do this in your ear? Just beep, beep, beep. Ready?
Yeah.
Beep. Perfect.
Good boy.
And when he's coughing, what does his cough sound like?
It sounds like he's got loads of phlegm in his. To me, he sounds like it's
wet. Sounds wet.
Yeah.
Okay. Has he been coughing anything up at all? Have you ever found any like nasty green phlegm or anything? You're very chilled, aren't you?
He's tired.
Can we take his shirt off and undo his baby grow?
Yeah. Can I just use your bed over here for a second?
Yeah,
Because
that's fine,
I struggle to do this. Otherwise, it's a good boy. Who's my good little man? Where are we now? Where are we now? What are we looking at? Whee! I know. It's a terrible world, Francis, where I continually dress and undress you.
So is he waking himself up when he's coughing at night?
Yeah. Skin the bunny. Francis. Thank you.
Oh, that's a horrible thing to say.
That's what his mother says to him, and it works. He now puts his arms up in the air.
Oh, no.
I know. It's what her mother used to say to her, apparently.
Oh, God.
I think it sounds like a terrible thing to say to a child.
I think it sounds like a terrible thing to say to a child.
But now it's the only way I can get him to put his arms up to take his grow off. Come here.
Right, should we have a listen? Put this on here. Just turn him around.
Would you row?
His chest sounds completely clear. Let's have a little tap. Lovely.
You're fine, aren't you?
You're absolutely zonked, aren't you? I think he's just got a viral cough. Keep him well hydrated.
Come on, if I start reassembling it.
Yeah, that's
It
fine.
can take me a few seconds.
Reassemble your child. Is he in a cot?
Yes.
So prop the cot up underneath the feet, because if he's elevated a little bit, it's likely to help reduce his cough a bit.
Okay.
If at any point you think that he's actually struggling with his breathing,
Yep.
if you start seeing the muscles really working hard in between his chest, if you can see his ribs appearing when he's breathing, come to us straight away, or if it's out of hours, give 111 a call.
Okay.
You're happy enough, aren't you? Ticklish. You ticklish. You ticklish.
Why is it only at night?
It's just to do with the fact that you're lying down. OK, so any worries at all, give us a shout again.
Shall do. Thank you very much, Doctor.
All right, take care.
Cheers.
Bye. Bye.
I have got, I think it's a mole, but it's been a bit itchy.
We call it a seborrheic keratosis, and it's
Right.
just a little warty stuck-on thing.
Yeah. It's almost like there's a crust over the top of it, isn't there?
That's been getting a little bit darker and bigger. Not that it's that big. It's kind of a little bit of a dry, scaly one.
And it's just quite soft and loose.
Yeah, so that's more reassuring, actually.
Well, the good thing about this one is that it's a little fleshy one that sticks up and you can move it around.
I think that's what the doctor said last time.
Kay Frankson, please.
Hello.
Good morning. I'll have a seat.
Thank you.
I'm Dr. Jewell.
Hello, Dr. Jules. I hope I'm not wasting your time, but it's just people keep telling me to come and see you because I've got this mysterious mole that's suddenly appeared at the back of my knee.
So let's ask the standard question. Is it bleeding?
No.
Itching?
No.
But it's new.
It's new and it's...
But you don't, because if you have many moles.
No, not really.
The average number is 40.
Is it?
Yeah, so most of us have got a collection.
Oh.
So let's have a look at it.
It's this one, so it's at the back of my left leg.
Ah, at this point I have to do something which is fraught with risk.
Oh, hello.
Get down on my... Is it this thing here?
Yes.
Okay,
Well, there's
that...
a cysty thing as well.
Have you seen? Have you looked at them?
I can't see them
So
really.
which is the one that everyone's worried about?
The one that's actually coloured and looks like a mole.
Well, they've got 3, 4 of those.
Oh, well, there you are. You see, I can't even see them, so I didn't know.
These are obviously, quite obviously, warts. Because what they're doing...
That's horrible.
Look, what they're doing is when you bend your knee, you're spreading them. I think the sensible thing to do is to take a photograph of them.
I've done that. I did it the other night to have a look because I knew I was coming to see you.
You know, check it again in a few months' time.
It was quite hard to take, actually.
Oh, I'm not suggesting you. Surely you can get somebody else to take it, can't you?
Could do. Hello, would you like to take a picture of my mole?
I don't really have any other suggestions because they look completely normal.
Okay.
All right.
All right. So that's it then.
Yeah. And do come back if you're worried. You know, don't. Whatever you do, don't let concerns about wasting anybody's time deter you. That really, you know, this is a 5-minute business. It will take a bit longer, but
all right.
It's not a big deal at all.
Okay. Well, thank you very much for reassuring me.
Good.
And have a nice day, as they say.
Bye-bye.
Bye-bye.
Catherine Bowers. Come and have a seat. I'm Dr. Barnard. I don't think we've met before, have we?
Before. Basically what it is, I'm a diabetic.
Yes.
And I got I got a blister to my little toe and the next toe.
Yes.
Underneath, and I think it's got infected. Because it's really sore, I can't walk properly, and there's like a red line just starting to go up there. It's not the first infection I've had in my feet before. It's...
Oh, goodness, that looks
really
quite
sore.
nasty, doesn't it?
Yeah, it's very sore.
How long's it been going on for?
It's only started getting red and swollen past 2 days, and that line just showed up this morning, but it's been sore for a week.
Right.
But I didn't think it was infected because I kept it clean and stuff like that.
Yeah.
But it's just, I think my toes swollen as well, and that line's coming up, which is worrying me a bit.
And are you under podiatry or anything like that? Have you been in the past?
No, because I don't like people touching my feet. I hate it.
Okay.
I can't bear people touching my feet.
Can I have a look?
Yeah. I mean, I must admit the one on this toe I left a bit too long and it got very nasty.
Pull that toe back for me.
This one?
Yeah, it's really painful, isn't it? Put your foot back down again. Fine. OK. That looks really sore.
It is sore.
Because you've got the diabetes, we have to be really careful, because you know if we leave foot infections untreated or not properly treated in diabetics, it can be quite serious.
Lee Huggins? Hello?
Hello, you all right?
Yeah. Come on in.
Thank you.
Have a seat. How can I help?
It's my right kneecap.
OK.
I'm all right doing long walks, but when I stop, it seizes up.
Right.
And I have to let it rest for a while before I can... And if I start walking it straight away, it hurts.
Yeah.
I can kneel down on this knee, but I can't put this knee down properly.
No. Can we have a look at your knees? Do you want to just pull up? And could you do that with the other one as well, just so I can compare them? That's it. You can see that it's a bit swollen up there, can't you? And if I just have a press round that side, that's OK?
Yeah, that's fine.
Round here? Does it actually hurt if I press there?
No.
OK. And if you fully straighten it, does that hurt? No? Bend it? Straighten it? Well, that's pretty good, isn't it? And if you just move your knee just so that your ankle's there, yeah. And I'll just give it a bit of a test. It's quite stable, isn't it? Yeah, good. OK, you put your trousers back down then. Your knee is taking quite a lot of weight at the moment because it's the main joint that carries you around. Have you had thoughts about losing quite a bit of weight at all? Any thoughts about I mean, I think it would really help with what you're here for today.
Think about trying the Weetabix diet.
The Weetabix diet? So what's that one?
Just Weetabix 3 times a day and that's it. And
Really?
you play with your fruit.
Right. Sounds a bit crazy to me. What do you think about it, really, the Weetabix diet?
I think it's all right.
Yeah? I mean, do you know how people successfully lose weight?
Well, you've got to mix the exercise and the healthy eating sides.
Most of losing weight is simply eating less. So I actually say that most people who successfully lose weight just say, I'm going to change the way I'm going to eat for the rest of my life. Because a lot of people do these diets, like a Weetabix diet, and unfortunately, when they go back to what they normally do, they just put the weight back on. So sometimes I suggest to people they just reduce the quantity, because quite often, quite a lot of us are eating more than we need to.
I have breakfast. Sometimes have lunch.
Yeah.
But I do have a dinner.
Yeah. People who eat breakfast are in general thinner than people who don't. And people who eat a small regular meal 3 times a day are lighter than people who don't do that. Your body is sort of needs regular eating. We all eat our main meal in the evening in this country. And the problem with that is that we're having a lot of calories and then we go to bed. And actually, when we need the calories is the morning and the lunch, and much less in the evenings. If there's any way that you can change that around and have your main meal at lunchtime, that's supposed to be healthier.
OK.
If you wanted some more help about losing weight, then you could book maybe to see one of the practice nurses or something along those lines.
OK.
Is that all right?
Yeah.
OK.
Thank you for that.
That's all right. Nice to see you.
Nice to see you.
Bye now.
Bye-bye.
Can I touch your feet to see what the pulses are like?
Yeah, both feet.
If it's too much.
No, it's OK.
Is that very sore?
Yeah, that is, yeah.
OK. Patients with diabetes are at increased risk of having problems with their feet. This is because the diabetes may reduce the blood supply to the feet and may affect the sensation. This means that patients may not notice when they've got a sore foot or an injured foot. If it is not treated promptly, the patient is at increased risk of having a serious infection and ultimately, in the worst cases, at risk of amputation. What I'm going to do is I'm going to give you some antibiotics. We're going to get you booked in with the nurse to get it dressed and things, and then I'm going to have a look at referring you to the diabetic foot clinic.
OK.
If I do that, will you go?
I promise you I'll go, because I don't like people touching my feet, but I don't want to lose my feet either.
More than anything, we need them just to look at it, keep an eye on it. OK.
Thank you so much.
So look out for the appointment, but if there's going to be anything different, and they're just going to give you an appointment straight away, I'll ring you.
Thank you so much. Thank you.
Okay, bye.
Bye.
Mr. Thomas, please.
That's me.
Hello. Sorry, you've waited a little bit there.
That's all right.
There we go.
Thank you.
Right, do have a seat there. Hello.
Cheers, hiya.
Hi, I'm Dr. Bolam. All right. What can I do for you today?
Well, it's been coming on about 3 weeks now. This lump, it started off, well, didn't even notice it really, and then gradually, it's not got any bigger. It kind of, if anything, spread slightly.
Yeah.
But it's just fluid, I guess.
Yeah.
But I thought I'd leave it a few weeks and it'd probably go away.
I know exactly what that is.
Oh, right, yeah.
Okay, it's a bursitis. Okay.
Yes.
So we all have fluid-filled sacs around our joints called bursae.
Right.
Okay, which can get swollen all of a sudden, okay? Usually caused by repetitive trauma. So that one there, people get them on their knees often. Anybody can get it.
I got you.
So that's an olecranon, that one, over the outside of the elbow. All right? Is it painful?
No.
No, not painful.
Maybe
Okay.
if you put pressure on it, like lean on it or something, it might be annoying.
They can get infected, but it doesn't look infected, so we don't need antibiotics,
Oh,
all right?
Okay.
Usually, the first line is to take an anti-inflammatory,
Yeah.
right? Get something to compress it, so go and buy yourself an elbow support from the chemist, all
Yeah.
right?
Okay.
Put ice on it, and it usually just goes away, all right?
Brilliant.
And only if it gets red and hot and horrible do we need antibiotics, and we're not at that stage at the moment, certainly. All right? Yes, have a little read of this.
Yeah, sure, thanks.
Tells you how to treat it.
Yeah, I lost a wife coming up 5 years August, and seeing her in conditions that she was in, it does tend to make you...
Yeah.
I mean, I don't come to the doctors
Yeah.
very often at all, but it suddenly... you think, well, one thing,
Yes.
keep on top of
yes,
it, you know.
I can absolutely assure you that's nothing.
Ah, lovely.
100%,
All right.
actually.
Thank you very much. For
All right,
putting my mind at
okay.
ease.
All right, okay.
Thank you, doctor.
Okay, have a read of that.
Yeah.
Do what it says.
Thank you
All
very,
right,
very much.
Is that okay?
Yes, thank you,
All right,
doctor.
okay.
Cheers now.
All right, have
Bye-bye.
a nice day. Bye-bye.
Bye. It's all right, I got a bit of OCD as well, don't worry. It's not worth talking about, I just handle it.
All right. Okay.
Bye, thank you.
All right, bye-bye.
Bye-bye. Bye.
Thank you, have a nice day. And you, bye.
Thank you.
Bye-bye.
Bye. Do you feel better now?
Yeah, I feel better. You gonna say bye now?
Yeah.
Reluctantly. See ya.
Good morning, Wolford Health Centre. How can I help?
It could kill you. Yeah. Or paralyse you, stuck in a bed at a young age.
There's a viral bug that's causing a bit of sickness, a bit of vomiting.
But yesterday, someone told me if you're puking up, you could have stomach cancer.
I could hardly hear anything yesterday.
But you're not having difficulty hearing me.
No, no.
And if I lower my voice, you can still hear me.
So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore.
I need to bring your arms slowly forwards.
Oh, ow, that's new.
Good morning.
Hi, all right. Filled out all the forms and stuff.
We're all good to go. Hopefully you won't be sick, but welcome to the practice.
Thanks for your help. Cheers.
All right, thank you. Bye-bye.
Bye-bye.
OK, hello, everybody. All right, you have a seat. How are you doing?
My chest is quite bad.
Right, OK.
I had a scan on Friday.
Yes.
And the baby's fine.
Yes. That's
No
good,
worries at
isn't
the
it?
moment, yeah.
Yeah. So how long's the chest been a problem for?
Over the weekend.
OK.
I don't know why. I don't know if it's changing weather or changing hormones. I don't know.
Yeah, and tell me a bit about it.
Just struggling to breathe.
OK, so sort of tight.
Yeah.
Yeah.
Can we come off of there, please?
And remind me, you're asthmatic, yeah?
Yeah.
And you take 2 different inhalers, yeah?
Yeah.
Have you haven't had that many of them actually, have you?
No, I had spare ones at home, but
yeah,
I haven't. I'm just on my last one.
OK. What do you think's going on?
Tommy,
Tommy, I'm going to give you something to do, all right? Can you do a drawing for me, OK?
Sorry.
It's all right. So let's just see what your temperature's like. That's normal. Is the pen not very good? What you have to do is you have to hold the pen so it's like that, OK? Do you want one too? Yes? Okie dokie. You're good at drawing. OK, there you go. OK, so let's have a listen at the back first, just to breathe. Oh, that's fantastic. Oh, you've written your name. Wow. Can you do that again? You are quite wheezy, actually. Let's see what you get on this. $300. So that's a bit down.
Hopefully I can be fairly brief.
Oh, well.
In 2012, I came to the surgery to talk about jock itch, because I was getting itchy.
Right.
So he gave me some Dactacort or
Yeah.
something. And it's never really gone away, 5 years later. And then, obviously, a lot of it's out of sight. And I took a photograph of my buttock about 3 days ago, and I thought, well, actually, I need to try and do something about it. I presume that's all part of the same...
Probably.
Same thing.
Yeah. Can I have a little look today? Is that
Yeah.
right? Do you want to go behind the curtain, or are you all right?
I'm not bothered.
And is it itchy?
You know, the general itchiness, it comes and goes a bit.
Yeah.
There's up the crack there.
Yeah. Is there anything around the front?
Well, it's often a bit itchy underneath.
Yeah. There's not much to see at the front there.
But, it comes and goes, but it's never really gone away.
Sure. So it does look very fungal.
Yeah.
And the Dactacort cream has got some steroid in, which reduces the itch as well. So it's a really good starting point for what you've got. Now, if it's not working, then we can try a different antifungal medicine, and usually that will we'll find something that we can use that works.
Yeah.
And the other thing is to try a slightly stronger steroid, just because the area is all a little bit inflamed.
Right.
And I think that will help settle down the itching side of it.
Yeah.
Sometimes you need to use a tablet of antifungal
Yeah.
to make sure that you're getting on top of it, because sometimes it's
Right.
tricky to treat. And if it's been there for a long time and cream isn't making it better,
Yeah.
then that may be the next stage.
Yep. OK, that sounds all right.
Nice to see you.
OK, thanks.
Great, I hope that
Cheers.
works.
Yeah, I'll give it a try.
Bye-bye then.
Thank you.
That is a bit down, your oxygen, compared to what I'd expect it to be. Right, I think what we should do is treat this as an asthma attack. I think we should give you 3 things, yeah? I'm going to give you a spacer, like one of those...
Tommy, get down, please, because you'll hurt yourself, good boy.
If I draw a picture, will you colour it in? What's that?
Dinosaur.
A dinosaur? I know I'm rubbish at art, but it's not that bad.
That's
it's a cat. OK, you colour it in with that biro, OK?
Tommy, that's a dinosaur.
Oh, that's brilliant. OK, so I'm going to give you a week of steroids, a week of antibiotics. It's OK with the pregnancy. In the meantime, you could also use a bit more of the blue inhaler at a time, which I'll give you. And unfortunately, in pregnancy, fantastic colouring in. Your asthma can get worse. Thank you very much. Now, can you put the lid back on my pen? And are you going to give me your picture? Thank you. And we'll see you again if that doesn't sort it out.
OK, thank you so much.
That's all right. Bye, boys.
Thank you.
Bye now.
Oh, dear. You still got your cough?
Oh, it's
yeah.
terrible. They said will last 6 weeks, so it's only 3.5 weeks so far. So.
Not that you're counting.
No.
Yes, what can I do for you?
My anxiety's through the roof at the moment. I cry for days. I can't go to the toilet, that's another thing. And when I do, it hurts.
Doing a poo or
yeah,
a wee?
And I keep getting pains under here and around my back. And you know me, I convince myself it's my heart. Oh, I know, I know. I can't help it. I hate being like this, I really do.
I know.
Sorry.
What are the big stresses you've got at the moment? Apart from your physical thing, what's going on?
Apart from Edward just leaving Bristol, nothing really.
And then her other door's leaving as well.
How far are they
They're
going?
just going, one's going to London, one's gone to Dawlish. I don't know, I phoned 111 the other night and this guy chatted to me for like half an hour. He was absolutely fantastic. He managed to calm me down and the pains went. I know I'm probably a waste of time and space and energy, but I just feel... I just want to cry. I don't want to cry. But anxiety is something you can't help. I just can't switch it off and go, oh, it's nothing, and carry on. When I'm sat in a chair crying, I generally feel, you know, this is the end. If I can't get to the toilet, I push so hard that I do get pains under there or in there. So I know it probably is constipation as well. I just feel an idiot now, sat here, feeling stupid.
But you've got a problem. But I think your problem's anxiety, really, and fibromyalgia. When you say you're constipated, how many days has that been for?
I couldn't go yesterday. I couldn't go the day before.
Come over here and let me feel your tummy and just have a look at you.
I'm sorry.
OK, so lie yourself back. Do you ever pass any blood or anything?
No.
A little sore there. And over there?
Yeah, that's where I usually get my IBS pain.
OK.
If you find a heartbeat that's not mine, we're in trouble.
So what you've got is very exaggerated bowel sound, so it's going blah, 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 blah in there, you know, it's noisy.
Dr. Robert said when he diagnosed me with irritable bowel.
Is that what he said? Well, it's the same thing. So I think at the moment...
It's not irritable, it's downright nasty.
Yeah, nasty bowel, but it's not dangerous bowel, and I'm sure it's the same thing. And when you get stressed...
It plays up worse.
It plays up. It's awful. Do you remember over the years what treatments you've had for anxiety? Did you have cognitive behavioural therapy?
I did. I think that was left once.
If you ever want to try CBT again, we can get you sent back, because in the long run, that's probably going to be the most effective. Go home and just think about this being anxiety and
relax.
And relax. And your children haven't left the planet. They're just doing well and gone
You've got
to
your
London.
grandchildren.
Yeah. Well, you will get used to it. It just takes a while.
Thank you.
Okay. All right,
you.
OK, bye.
Thank you, bye-bye.
Ronald Trump. So you haven't been up to much in America recently, have you?
No.
I phoned the 111 people and they scared the hell out of me by saying, oh, you've got an hour to get to the hospital. I was like,
I think by that what they probably meant was your appointment's in an hour, so you've got an hour to get.
And it looks a little bit snotty.
Say, no, I don't.
I have a migraine.
Migraine. I don't know what you call them.
I don't even know how it's spelled, so I'll just leave it there.
Did you see any boats on the canal?
On the canal?
Yeah.
What
the
canal? Oh,
Hi, what are we talking about?
Right. Basically what it is, I'm finding my ankles in particular really difficult to deal with, especially my right leg. I don't know what this stuff is on my skin, but it seems to be pain, swelling.
How long's it been swollen like that for, then?
The last few months.
Is it in the ankle or is it in the leg?
It's right in the ankle.
Yeah, let's have a look at the other one.
Now, the other one is...
So what happened to this leg, then?
Oh, this... God. I had polio when I was a baby. I was one of the last ones to actually get it and caused paralysis from my knee downwards into my foot. And this is necrotizing fasciitis. Started off with a stinging in my knee.
Yeah.
Then after about 10 minutes, I started shaking and perspiring.
Yeah.
I read up on it, and there's a certain type of house spider which carries a bug.
So it's left you incredibly disfigured, hasn't it? With all that infection, and then presumably they did an operation on it?
Yeah, they had to take...
you were lucky not to lose the leg?
Yeah, layer of skin from my bum.
Yeah.
It's such a nice bump before as well. But,
it's this one that's the problem today?
My foot won't be very clean because...
That's all right, don't worry.
I can't get down.
That's all right, don't worry. This brown skin is called varicose eczema. And that's because of the varicose veins, the fluid leaks out, and that brings with it some iron. So some of the veins then leak, and the iron it gets deposited in the skin, and it can cause usually itching and brown staining, but it doesn't usually cause a lot of pain. Can you make the ankle go round at all?
I've got no movement in my toes whatsoever.
OK. So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore. It's stupid. It just get laughed at.
And you've had the heart done as well, haven't you? And I guess I'm just wanting to listen into that and listening to check your chest as well.
The brain's all right, by the way.
Good.
So far, anyway.
So, I think that there are lots of things that are going on here.
Yeah.
One of them is that I think you've got this varicose eczema, and I can give you some steroid cream that will help in case any of this is linked to that rash that you've got.
Yeah.
It wouldn't particularly explain the leg swelling.
No.
And it's also that there may be some arthritis or some damage in the ankle on that side as well. So I'm going to get an X-ray of the ankle and just see what that's doing.
Right, OK.
In terms of the heart, that could be linked as well, because you've had the valve replaced. Sometimes if the heart isn't pumping very well, that might make some fluid collect in the ankles as well. So I'm going to get a blood test to check the heart and the kidneys and the liver, and I'm also going to do a chest X-ray to make sure there's no fluid collecting there. Now, when I listen, there isn't, so that's good news.
That's brilliant, OK.
How's that for a plan?
Yeah, that's fine. I've given up the cartwheeling. It's just ridiculous, you know. Anyway.
Listen, well, I'm glad that you're keeping in good spirits.
You've got to have a sense of humour, otherwise you just go absolutely...
Well, I think that's definitely true. That's definitely true.
OK, thank you very much. By the way, what's brown that runs around the garden? A fence. All right, see you later. Bye-bye.
I'm Dr. Graham. So how can I help today?
I have had a sore throat since Wednesday, and as of yesterday and today, it is raging.
And have you noticed anything else, like a temperature?
Today I probably feel like I've got a bit of a headache and a little bit hot, but then I've had a boozy weekend, so I don't know if it is that.
OK.
So I can't really differentiate between the two at this minute.
And are you coughing much?
Not coughing much, no, but if I have had the odd cough, then it really hurts sort of right in there. I can
bring anything up when you cough?
No, I'm not bringing anything up.
OK. And you remind me, do you smoke?
No.
OK. So let's check you over. Take your temperature first. Open up wide. Put your tongue back in, actually. I'm going to put it down a bit just to look at the throat. OK, that all looks fine. You actually don't have any tonsils to see, which is normal for your age.
Right.
OK, so they disappear as you get older because you don't really need them. Just relax your chin down. And it doesn't look too red, and you've definitely not got any pus or anything. Does that feel sore
really,
under
really
here?
Sore there, yeah.
OK, so that is sore there, but no glands that I can feel. But that is where your glands are, and they probably are sore there because that's... Do you know what your glands are for?
Not ever really thought about it, to be fair. But...
so they're where you make white cells. So when you've got a sore throat or any infection, you make more white cells, and that makes the gland get bigger. And often it actually hurts quite a lot, in some ways more than the problem that it's trying to fight. So I think that's the main problem. So I think the most likely thing is that this is a viral sore throat, OK? And that unfortunately it will last probably another at least few more days, maybe even another week.
Right.
You've had it since Wednesday, so it's about day 5 now. And they say that it takes sort of 7 to 14 to clear. And at the moment, I think that you will, you're normally quite well and you will probably clear this yourself. It's a kind of annoying problem where, if I get it, it's not much more I can do apart from take take painkillers and wait for it to go.
Okay.
And at the moment, there's no evidence that you've got the kind of infection that will get better quicker with antibiotics.
Right, okay.
Does that make sense?
Yeah, no, that's fine. I just wanted to make sure that there wasn't anything, because it's just been getting worse, so that's
sure.
fine. Yeah.
And was there anything else today?
No, that was it. So just plenty of fluids.
Yes.
Right.
Painkillers? Have you tried some painkillers?
I haven't, no, because I just find that sort of stuff doesn't really touch the sides, if I'm honest.
Yeah.
So.
I mean, it's entirely up to you, but lots of other people would take paracetamol or ibuprofen, or even gargling with aspirin. Some people find helpful.
Yeah.
Because it's sort of anti-inflammatory on the actual throat problem.
Okay.
But you don't have to take anything.
Yeah. Okay. All right. No, that's fine.
Great.
Lovely. Thank you.
Is it raining still?
It stopped. Stay that way.
All right then.
Thanks.
Bye now.
Bye.
They're waving too.
I'm not allowed to wave?
No.
Is it against the practice, the surgery rules? Yeah, OK. I'll remember that for next time. No waving, no smiling, no laughing.
Absolutely, yes.
And only compliment the reception staff.
Absolutely.
How you doing anyway?
Oh, just take it easy.
Right, so I'm Dr. McLaren. Nice to meet you.
Yeah, I've managed to slip in the bath, which aggravated my shoulder. And then I was looking out the window and it cracked. And I couldn't move. I was in so much pain. And today it just feels unbelievably tender.
Did you land on your shoulder? Did you land on your hand?
I kind of landed there.
Okay.
But it wasn't too painful.
And then subsequently, this pain just started abruptly when you were doing nothing, and since then it's been really painful. Have you tried any painkillers? Or...
I did yesterday, aspirin and codeine, but I can't really take codeine at work.
What is work for you?
I'm an apprentice plumber.
Okay.
So I need my marbles around me.
Okay. Is there anything that you were worried you might have done, or...
I'm paranoid it's a rotator cuff because it will take ages to heal. Hopefully you're going to tell me that it's something lovely.
Okay, like...
Something that will heal in a couple of weeks.
Okay. Well, let's take a look at it to start
Yep.
with. Easier for me with you stood up.
Stood up.
Now turn and face me. Okay. I want you to bring your arms slowly up. Touch at the top.
I don't want to.
You stop as soon as it's uncomfortable. So at what stage did that become uncomfortable?
Well, I grunted.
So...
Can I put them down?
Put them down. If you were to do the same forwards...
That's fine.
That's easy. And right the way to the top?
Yeah.
Easy.
Oh, ow, that's
right
new.
at the top.
Yeah.
If you go across there, that looks like it's quite uncomfortable.
It's not nice, but it doesn't hurt anywhere near as much as when my hand was up.
So you mentioned rotator cuff. It's not entirely typical of that, but I'm not going to be able to say with complete certainty that that's not what it is. This is your shoulder. Your rotator cuff is muscles which support the shoulder, which go over the top of the ball of your shoulder, around the front, around the back. The other thing that you have is ligaments and tendons holding the other structures together. You were quite tender around where your shoulder blade joined your clavicle.
Yep.
And really quite tender when you had to do that movement forwards, which is putting stress around this area, which makes me think it's probably a soft tissue injury to this area rather than your rotator cuff.
That's cool.
I think either way, I would expect with avoiding heavy lifting.
Like lifting radiators and...
Yeah, exactly.
OK.
Taking ibuprofen regularly. Things should start to improve, certainly over the next couple of weeks. And if you're not making any progress, come back and see us. OK?
Right. Thank you very much.
Hi, can I help?
I want to make an appointment for Dr. Edge next.
Just the next possible appointment.
Yeah. Is your mum a doctor?
Yeah.
You look so like that.
I know, I hear that a lot.
Lovely.
Hello.
Hiya. I did bring my mum down before to have a little test for dementia, and she passed. She's a bit forgetful. Like, things will come out not quite in a proper sentence, like words would be the wrong way round then. Yeah. She can get quite argumentative as well, which I know is another sign. If it is the early stages of dementia, I would like to know if she can possibly start taking the tablet that prevents it from coming.
OK. We're quite a long way off that, OK? We'd have to make a diagnosis first, and there's certain things that we'd have to do, but we certainly talk about it.
Yeah.
We'll talk about that now. Is that all right?
Mm.
How long ago was it that you brought her down and she had the test for which she passed?
About a year,
About a year.
OK. Do you think that you've got worse since then?
No, not really.
Do you?
Yeah, but not really bad.
You're living on your own? OK. To get a diagnosis of dementia, we ask lots of questions, but lots of us get a little bit forgetful.
Yeah.
But are you functioning OK? For example, are you managing your own money and your
Everything.
shopping and all that kind of thing? Yeah. Functioning fine?
Yeah.
So the geriatricians, the elderly experts, would actually say that you need to have both the sort of forgetfulness and all that sort of thing and what we call a functional problems.
Right, OK.
Like not being able to do stuff. OK?
Yeah.
But let me just find the previous...
But he was adamant I was all right. Wasn't he?
Yeah. Yeah, which is good. You think I'm coming down and I want you to have dementia? I don't. I want it to be stopped if you have got it coming.
Health Centre can help you. Oh, sorry, my lovely. Yeah, it's just really busy, I'm afraid.
I was sitting in there and I've seen it so packed.
Are you running really late?
Yeah, I am, sorry. You can come to the duty doctor surgery at 11:30. I'm sorry.
It's a week on it.
Yeah.
I'll be back in 2 minutes.
What a day it's been.
Have you been busy?
Oh, yeah, manic.
Thank you for waiting. I've had a few urgent things going on.
Yeah, you can't be dealt with.
God, it's only 5:10. I feel like it should be 6:10.
Thank you for waiting.
It's all right. It's busy.
It's always busy.
All right, let's do that same questionnaire again. OK, first thing I'm going to do is I'm going to give you an address. I want you to say it back to me, and then I want you to try and remember it, and I'm going to ask you again in a bit.
To confuse me.
The name and address I'm going to give you is John Brown, 42 West Street, Kensington. Could you repeat that?
John Brown, 42 West Street, Kensington.
OK. Can you tell me the date today?
7th, I believe.
The year?
70.
Excellent. Can you tell me something that's going on in the news at the moment?
All the fighting, the shooting and that, you mean?
What do you mean exactly?
Well...
Who's doing it, Mum?
Oh, sorry, ISIS.
OK. All right, that's fine. Can you remember that name and address for me now?
John Brown, West Street, Kensington.
What number?
Oh, I didn't hear a number. Did you give one? I'm sorry. I didn't hear the number.
I didn't hear the number.
The...
OK, you clearly remembered it. That's fine. All right. She's not going to fail this. OK, now I'm going to ask you a couple of things, all right?
Yeah.
Compare now to a few years ago. Is she having more trouble remembering stuff that happened recently, like the news and stuff?
No, not the news, per se, but she might put her glasses down and she can't find them.
Find them, all right. Does she forget what you've said to her?
Sometimes, yeah.
OK. Trouble with financial?
No.
Pain? No, OK. Manages her medicines?
Yeah.
I don't think there's any sign here.
That's fantastic.
OK?
Yeah, that's
All
brilliant.
right.
Yeah.
So now I can cuss her, can't I?
Yeah, you can tell her.
Keep telling me off now, yeah. No, but it's only because I work with people with dementia. To me, it's like I see little things.
OK, well, let's keep an eye and you can ask me. But, I mean, so many people get that thing about putting the glasses, you know, I mean...
Easy done, isn't it?
Yeah, no, yeah, but she wasn't like that before, do you know what I mean? It might just be old age.
It's just age.
Yeah.
Yeah, I'm sensitive.
I would rather my mum, you know, got old gracefully rather than ending up...
OK. I'm not going to say anything about that.
Nice to see you after so long, though.
Nice to see you, yes.
Yeah.
All right. Right. OK.
Thank you.
All right,
Bye.
OK. All right, then. OK. Yeah.
Sorry, my key's on the floor.
Oh, that's no good. No, I won't be testing you for your forgetfulness.
Thanks,
all right, OK, bye-bye.
How can I help?
My son is here, but I can't find him.
What's his date of birth?
Oh, now you're asking. 17 of the 3rd. 02, I think it is. No, it's 23rd, isn't it?
23rd of March.
His sister's 17th.
Okay. Right, what can I do for you?
Well, I came Friday.
Right.
Because I've been got a blob in my eye.
Yeah.
And I went to the eye hospital and he's told me that I've had a stroke.
Right.
My eye aches and my head aches all the time. And I think it's affected my hearing as well because I hardly hear anything.
Yeah. So how do you feel about what they said?
Well, I was a little bit shocked.
Yeah.
But he said they're referring me to the stroke clinic.
Right, okay. Have you heard from them yet?
Nothing, no.
No. I'll try and chase that up. We'll have a little look at you and then I'll see if I can get through to the stroke clinic now. Because you need some blood tests and a full assessment. How long did the problem with the eye last for?
I've still got it.
You've still got it, yeah. Okay. Your blood pressure's good, so that's good. Can I just have a little listen to your heart? Okay, sometimes it can be an irregular pulse that can cause a clot to travel around and cause the stroke, but at the moment it's nice and regular. Deep breath and out and hold it there. That's fine, okay. Right, so they'll arrange a CT scan in the stroke clinic, okay, to assess your head. What we want to do is reduce your risk of having this again, okay, and try and work out why you had it this time. Do you smoke at all?
Yeah, but I've cut down since.
Okay, how much do you normally smoke?
Well, about 10 or 12.
Okay, you need to stop.
Yeah.
Yeah? This is a warning.
Yeah.
And luckily, you're good. Yeah? But it could kill you. Yeah. Or paralyse you, stuck in a bed at a young age.
OK, what can I do for you? So, just today, I've had this rash kind of appear. It's quite bumpy.
So, any of these tattoos new?
No,
'Cause
these are
sometimes
all...
you get
these
reactions
are all, like,
to tattoos, so...
10 years old.
I agree. It is a little bit lumpy, bumpy skin, isn't it?
And it's just been quite...
But it's interesting because you're lumpy, bumpy in the area of the blue. Actually, let's just look under, getting under this magnification. So, this, I mean, it looks very much like this is some of an allergic response to the ink in the skin, and we do see this from time to time. And usually, it's when somebody's had, you know, a new tattoo or something that's caused it to flare up. But that's not the case with you.
No.
In terms of what we do with this, if it's really troubling you, a mild steroid cream will probably settle it down.
That's good. It just puts my mind at rest. And
so you used to work in one of the churches, is that right?
No, I work in Southmead at the Southmead Development Trust, which is a charity.
Going well?
Yeah, very well. I mean, we're trying.
And last time you came here, you did talk to Dr. Wardock about a vasectomy, did you?
Yes. I think we're ready to take that to the next step.
You are ready, or
we are ready. Having talked about it. So
OK.
I need to. What is the next step for that?
Well, the next step is one of us needs to write a letter, actually, basically, and get you seen. You've got 2 kids? Both in good health?
We've got 2, yeah.
Both in good health?
Oh, yeah, absolutely fine, yeah.
Your wife wants to go ahead with this?
Very lively, yeah, she does. You know, part of the reason is that we've tried pretty much all the other kind of long-term contraception things, and they've all just been, you know, had side effects and just been a bit unpleasant, so...
Richard gave you a leaflet with all the...
He did, yeah, I read that, looked for all that. Yeah, that was
so it's your call. I mean, we don't need to deal with it today, but if you
if we can write the letter...
I can write a letter and get you in the system.
That'd be great.
Fine.
Excellent.
OK, and then the next thing you know is that you'll get a letter with an appointment to go.
Yeah, that'd be fantastic.
To have it done.
Yeah.
Take it from there.
Yeah,
OK.
That'd be fantastic.
Looks like Richard's giving you the chat ready.
He has, yeah.
OK, I'll get that done.
Thank you very
much. You sure I'm not pushing you into...
No, absolutely. No, honestly.
I saw that was the last thing. It looked like you'd been left hanging.
No, we talked about it. We thought about it for quite a long time, and then kind of just... I think that might have even been before Christmas.
I'll give you a 2-day cooling off period, OK? I'll write a letter next week if I haven't heard back.
That'd be fantastic.
All right?
OK, great.
OK,
thank you very much.
Bye.
You're all right, your pain in your head?
Yeah, it's all there.
OK.
In the backs of my eyes.
I'll see if I can get through to the stroke clinic now. Oh, hi, I wonder if you could help me. I've got a patient with me who presented to us on Friday with eye symptoms, loss of central vision, and she was referred to the eye hospital. I mean, she needs to be seen today, really, doesn't she, if she's got ongoing symptoms? So shall I wait to do anything until you ring me back? Right, she's just going to check with the consultant.
I got a pain in this eye, and I'm worried to death I'm going to get another blob.
What's the one thing you can do?
Stop smoking.
Yeah. From now?
Yeah.
Yeah. Because that's the biggest risk.
Yeah. What causes blood clots, Sam?
So, as I said, one of the commonest ones are an irregular pulse. Another one is narrowing of arteries in the neck. That can throw off a little clot, and that can go to the brain as well. So what they'll probably do at some point is arrange a monitor to monitor your pulse over a week or so to check to see if that happens. And also they'll probably scan your neck to check there's no sign of any blockage there as well. OK. And they'll probably arrange a CT scan or an MRI of your head as well.
Yeah.
OK. A stroke is potentially life-threatening, so it's very important to act quickly if anybody's got the symptoms of a stroke. A way of identifying that is by using the word fast. So the F is for the face, if there's any facial drooping. A is for the arms. Can people raise the arms above the head? S is for slurred speech. And T is for time, acting quickly by calling 999. Hello, Amanda Ramshaw. But as she's got ongoing symptoms, I'm concerned, to be honest. Just thought the guidelines say that we need to send people in. But yeah, so the options are we either send you to the emergency department today, or we can arrange to be seen in clinic tomorrow by the stroke consultant.
Yeah, I'll go tomorrow.
You'll go tomorrow, is it? OK, all right. Yep, she says she'd rather do that tomorrow. OK, bye-bye. Right, OK. So I'll send this off now. It says all patients should have 300 milligrams of aspirin, OK?
Right.
And you mustn't drive.
Right, OK.
If you don't hear anything by lunchtime tomorrow, let us know.
OK.
All right.
Yeah, thank you very much.
If you want to make an appointment for the smoking clinic, please do.
OK.
All right. OK, good luck.
Thank you.
Bye-bye.
Bye.
Right, my love. Take care. Bye.
Come on through. Hello.
Hiya.
Come on in, come and take a seat. I'm Dr. Ahmed. So, Murath, you had a accident. You were knocked off your bike. Did you go to A&E when that happened?
I went to A&E, and after A&E, we came here.
Yes, you saw Dr. Pelly. You had cocodamol and naproxen given because you've got a dislocated little finger.
This is not the problem while you were down there.
OK, that's all right. I just want to get the background first as well. And what's happening now with the finger or with the plastics team?
Finger is same. I got pain on my shoulder, really pain. And since Sunday, I haven't been eating. So I haven't been eating nothing. That's
You haven't kept nothing down since Monday.
Yeah, then when I go to toilet, it's just water comes out.
OK.
And I have really bad pain in my spine in here.
In your lower back?
Since the accident happened, my body changed. I don't know what happened.
How did you come off your bike?
The 26-ton of truck hit me off my bike. I nearly died. I nearly went underneath.
But you didn't hit your stomach or anything like that?
Last week.
So it was a close thing.
But someone said I might lose my belly button because I was so frightened. Belly button moved.
You listened to too many stories.
OK.
I talked to my mum back home in Turkey. That's what she said. But yesterday, someone told me if you're puking up, you could have stomach cancer. That makes me more...
Bless you.
No, don't. It's an allergic thing.
Oh, right. He's got a small allergy to dust mites, so that does make his breathing bad sometimes.
I'm allergic to penicillin.
Won't give you that.
Plasters, wool. I'm allergic to a lot of...
Wool?
Yeah. What? I don't know, I've got really sensitive skin, so wool makes me come up in a rash. Some shampoos make me...
It's the ginger gene.
It is.
I'm a closet ginger as well.
Can you be allergic to tea?
I wouldn't have thought that would be a reason.
How are things going with your breathing then? How are you
At the moment, things are good.
Yeah. Did you do the primary rehab then in March, it says here?
I went along to the actual appointment. My blood pressure was so high. I mean, I did warn them that I'd been kicked out of gyms before because of my blood pressure being so high. And it's not that. I had a reaction to the sulfites. I mean, sulfites are the worst to give me.
Right.
And I don't care what anyone says, I am allergic to them. I mean, the alcohol, it's the sodium sulfite in it, which is a confirmed allergy with me. They sterilise the equipment. And that is what I'm reacting to in the alcohol. And they put it in eye drops, ear drops. I mean, it's like I have no access to any pain relief because if I'm in pain, they tell me to take paracetamol, which contains sodium sulfite. So I have no pain relief, which is why I kick off so much.
So you're only taking the one inhaler then?
Yeah.
So
I can't tolerate the lactose if you have any more than that.
OK.
Because I'm lactose intolerant.
Yeah, saw that one. But you haven't had to have any oral steroids in the last year?
Well, the last time they gave me steroids, they nearly shut my lungs down. And that's the maize starch in it.
Yeah.
And with the maize starch, when the manufacturers manufacture it, they put sulfite in it.
Right, let's do your blood pressure. (146/82).
Good, it's back down again.
So, I'll get this ready. And you remember how to use this? Blow, but then you keep... Right, when you're ready, a nice big breath. Well done, take a seat with it. Let me write it all down. Let's have a look. Yeah, so we don't need to change anything. Right, but I will refer you to the primary rehab. So that's our plan. Is that all right?
Yep, that's fine. That's fine by me.
Lovely. And I'll see you hopefully in a year's time.
OK, I'll see you in a year's time. Bye.
Bye.
Someone told me if you puking up, you could have stomach cancer.
That's made you very worried about it. OK, so let's check you over. OK. And do you feel sick in between these vomiting episodes?
Yeah,
as if...
I feel sick.
I know he's quite poorly because he can't even smoke a whole cigarette.
There's always some good thing out of a bad thing. Are you able to just lie down on the couch?
Yeah.
OK.
There.
There's generally a bit all over, isn't it?
Yeah.
Yeah? OK, come and take a seat. So, look, I'm sorry that you had this accident from your bike, but
I think it's separate.
It could have been a lot worse.
Yeah.
This is a separate issue, you're right. I mean, I think you've got a bit of... there's a lot of it going around, actually, this week. There's a viral gastroenteritis or a bug that's causing a bit of sickness, a bit of vomiting, a bit of loose poos. So we can give some tablets to help with the gripey pains and just drink fluids, but I would stop the naproxen. It probably aggravates...
I don't have cancer or nothing.
No. There's no symptoms of any cancer.
OK.
OK. If anything gets worse, you know where we are, or changes, but this should settle things.
Well,
I'll give you that. All right?
Thank you very much.
That's all right. Take care for now.
Thank you.
Right, how can I help you?
Can I have some batteries?
Oh, is that what you wanted? I could do that, easy. 1 or 2 hearing aids, Mr. Dunn?
3.
3, and one in the middle.
What can we do for you today?
Well, it's my ears, doctor. For some months now, I've been getting like a buzzing. And a couple of weeks ago, I went all strange. I nearly passed out and I was sick. And then yesterday, the buzzing in my ear was so horrendous, it was awful. It was like it was full up with something, you know, sort of like blocked.
Have you noticed any difficulty in hearing?
I did yesterday. I could hardly hear anything yesterday.
But you're not having difficulty hearing me?
No, no.
And if I lower my voice, you can still hear me? When people get buzzing in the ear, it drives them mad.
Last night it did.
Kept you awake?
Did last night. I went to bed. I find that I've got noise going on in the house all day because then that takes it away. I've got the telly
that's
going.
Very interesting. you've hit on the solution almost.
Oh, right.
Have you ever been exposed to loud noise? Never worked in a very noisy environment?
Dry cleaners is about as
No.
noisy as it gets.
You're not addicted to going to awful loud concerts?
No, nothing like that.
All right.
No. A bit old for that now.
Tell me if I hurt you. Well, your ears are as clean as a whistle, I tell you don't need them syringing. That isn't the problem, whatever the problem is. Same with that one. Very good. Tuning fork. Can you hear that? If I put it there, can you hear it?
Yeah.
Good. Same thing. You hear that?
Yeah.
A bit louder there or there?
There.
Good. That's how it should be. What I'm going to do is call out some numbers to you. Just call them back.
Okay.
So if you put a finger in one ear, all right? 62.
62.
32.
32.
Thank you. Other ear. 78.
78.
14.
14.
That's fine. I can't find anything wrong with your ears. But, you know, you don't get the buzzing for no reason whatsoever.
No.
If things change, then we should see you again and do something about it.
You've disappointed my children now, you know that, don't you?
Because?
They think I'm all gone deaf.
How do they know? How do they know? We've proved you're not going deaf.
Oh, Mum's going deaf. They
don't want you to. Well, they don't want to get you to age before your time. All right.
Right. Oh. Thank you very much, Doctor.
Good.
Nice
Bye-bye.
to meet you. Bye.
Nice to see you. You gonna give me a wave? See you later. Good boy.
All right,
Cheers
thank
then.
you.
Bye.
Right, that's lovely.
Very good.
Thank
nice
you.
to see you, Tracy.
Okay.
See you in 2 years.
Yeah,
Or
probably.
sooner.
Yeah. Bye-bye. Take care for now.
Thank you very much.
That's all right.
Have a nice evening.
Thanks. Bye-bye.
Bye-bye.
Good morning, Corporate Health Centre. Sally speaking.
They are gross, aren't they? I've not seen one like that before.
Okay.
And I've looked at a lot of gross tonsils.
So what I think we need to do is ask the hospital to see you just to check there's no sign of a clot on the lungs.
We haven't really had a working toilet for a while,
How have you survived without a toilet?
just buckets.
You mentioned that you were feeling really bad yesterday and you got to a stage of worrying about whether you wanted to kill yourself.
Well, I've tried it before.
You've tried it before.
Were you speaking? How can I help?
Come on in. Hiya.
Hi.
So what's been going on then?
I just last couple of weeks I just been getting really bad headaches.
Oh dear.
And this morning I woke up with a really bad one.
Right.
This morning.
And what's been causing them, do you think?
I don't know, but I'm on tablets for.
He's got ADHD and he's on concerto, which is quite a high dose.
Right.
But at the moment, it's hurting his eyes as well, and underneath his eyes and all down here.
Right. Whereabouts in your head are they?
Just like, just all over.
All
me.
over. And,
Yeah.
And it's been there for 2 weeks on and off, or is it there all the time, or what's it like?
Sometimes at school, like if I'm reading or I'm looking at the board, like for a lesson, it hurts. Or like sometimes before football, if I'm hot, or I get them like randomly sometimes.
Okay, so when it's hot, it's worse. When you're reading, it's worse.
Yes.
It's been on and off in the last 2 weeks, and before that?
You've had them for a while.
I've had them for a while since I've been on my tablets, but I don't know if it's my tablets or not.
How long have you been on your tablets?
A couple of years.
Oh, I see. So you've actually had headache for a couple of years linked to the tablets. It's just it's been worse in the last.
It's worse, but the last fortnight has been really complaining a lot.
Right then. So you're going to Nepal, is that correct? Yeah. Okay, and going for 2 weeks.
Yeah.
Volunteering, yeah. And what exactly are you going to be doing?
I'm renovating a school.
Oh, okay, fantastic. So you said already that you need your tetanus and typhoid. Also hepatitis A, you need to be careful. So we'll quickly have a look through. It might be easier if you come round.
Okay.
A little bit. So the hepatitis A is spread through food and water and shellfish, you see, and person-to-person contact. And then typhoid, food and drink again, tends to be food and drink and hygiene, personal hygiene. And rabies, obviously. Any stray animals resist the urge to stroke. Even if you get a scratch or a bite, do go and get checked immediately. Make sure you're okay. You happy to have your injections today? Yeah. Allergic to anything?
No.
No chance of being pregnant?
No.
Not breastfeeding? No. Lovely. OK, we've checked all our safety questions. I just need to take your coat off so I can put it in your arm. If you've got any queries or your things change, you can look on a website called Fit for Travel. It's like the sister site of what we looked at. So it's got the same maps and everything on there. Cool. So this is the hepatitis A, OK? Sharp scratch. There we go. Right, sharp scratch. Right, then that's your typhoid. Make sure you're not bleeding. Right, come around the other side, and this will be the triple one. So, sharp scratch. All done.
Have you got any other symptoms going on?
No.
No weakness or numbness? Your arms and legs are working normally?
They're a bit achy today because I played football yesterday.
He was in a tournament yesterday, so he played football all day.
Oh, no. We lost in the quarterfinals.
Oh, that's a shame. Never mind. Put your arms out like that. Close your eyes. Squeeze my fingers. Pull me towards you. That's it. Well done. Push me away now. You can open your eyes now. Push, 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 push. That's great. Have a seat. I want you to follow my finger. Just no double vision at all?
No.
That's good. Can you feel me touching you here?
Yep.
All feels normal. Open your eyes really wide. Close them really tight. Show me your teeth. Blow your cheeks out. Give me a cough. Shrug your shoulders. Stick your tongue out. That's right. I'm just checking all the nerves to make sure they're all working okay. Right, I'm just going to shine this light in your eyes. Lovely. That all looks nice and normal. You said your vision's okay?
I can't read, like, so far, like, I can't...
Oh, I see. So it is a bit blurry on far vision.
We put it first down to the medication.
Yeah, well, of course, those tablets might be the culprit, mightn't they?
Yeah.
OK, well, I think I want you to have an eye test. And I want to reassure you that examining you, it's all completely normal.
Yeah.
So I don't think that there's anything more serious going on underlying all of this. I think probably it will be that the eyes are the culprit and that's the trigger. Have you got any painkillers? Have you tried anything to help?
Painkillers help.
We take paracetamol, is usually I give him.
OK, because it may be worth trying some ibuprofen on top and we'll just see what that's doing, and then I'm going to get you back in to see Dr. Bolam next week.
OK.
But if things get worse, then we'll see you again.
OK, well, I'll go and book his eye test now. Thank you ever so much. What did you say, Logan?
Thank you.
Good boy, bye.
Melissa Sargent. Hello, hi there, come on in.
How are you?
Very good, thanks. Come and have a seat here if that's all right. It's a little bit sort of crammed. Is that all right? What can I do for you?
So basically, I have a IUD inserted. It's been in for about 2 years, but I've been getting really bad cramps and pain when I'm having like sex. I can feel it in the top of my like cervix, and my period's been ongoing for about 2 months now. So it was about a week ago that I started feeling pain there.
OK. What I wonder is, has it moved?
Yeah.
Has it come down a bit? Do you feel like it might have done? Is that what you had in mind?
Yeah, because I'm not sure what else could kind of... I'm normally really regular with my period.
So what I'm going to do is see if it's sitting down in the neck of the womb.
OK, sure.
Not terribly pleasant, but it's not terrible. So I'm going to get you over lying on here, and you're going to need to take all your bottom things off, I'm afraid. But it's warm today, so that's not
it's
not a freezing day. So what I've got is the speculum, you know that
thing they used to put it in,
and I've also got some swabs, because sometimes funny bleeding can be caused by an infection.
Yeah, okay.
So I'll just check you for chlamydia whilst we're about it. Yeah. And if there's any discharge, I'll take this swab as well. So it's a couple of swabs. Oh, so bend your knees up for me. Is that all right? First thing I'm going to do is I'm just going to feel the womb and see how everything is in there.
Are you sexually active at the moment? No. OK.
Have you got a regular partner?
OK. Have you noticed any itching, soreness, discharge down below?
Just use condoms all the way.
Are you sexually active at the moment?
Rarely.
As much as you get a chance.
Yes, exactly.
Just relax a bit there, take some deep breaths. That's great, well done. That's all. OK. How's that? Yeah, sorry. You can get up and... You're all right?
Yeah.
Very good. If you like to get up and get dressed... So, two possibilities, well, three actually, I suppose, that we have to think about.
OK.
One is that you got pregnant. I don't think this is likely to be the case with the coil in, and it's causing funny bleeding. So I think we should do a pregnancy test.
OK.
The next is that the coil has slipped.
Yeah.
And that actually we'll have to take it out. And then the third is that you've picked up an infection of some sort that's causing it all to be sore.
OK.
The question is really, are you sexually active?
Yeah.
Because if you are, and not using condoms, that is always a possibility.
I've had the same boyfriend for, like, more than a year now.
Yeah, so it's very unlikely.
Yeah.
The coil's a good option for Melissa because once it's fitted, it's sitting there doing its work without Melissa having to do anything about it. And this makes it much safer than other sorts of contraception, such as the pill that you have to remember to take every day, because however good you are at that, sometimes you're going to forget. The coil might not be for everyone. For example, if you have more than one sexual partner, you will be exposed to sexually transmitted diseases, and the coil can transmit those diseases up inside the uterus and into the tubes and increase your risks at a later date of infertility or of pelvic inflammatory disease. And then we're going to need to see you again in a couple of days' time, probably. Is that all right?
Yeah, no, of course.
Callum Chick, please. Hi, Callum.
Hi.
Yes, obviously I've seen you before, so I sort of scooped you out there because I know a bit about what's going on. But we're not really getting on top of this, are we?
No.
When did this start? How long ago did this all start now? It's been going on
probably about 3 weeks ago,
yeah.
maybe.
And you had a definite water infection at one point, didn't you?
Mm.
Yeah? And you had the right antibiotics and you took the full course?
Yeah. My mum says she thinks it might be a kidney stone.
Two thoughts about that, OK? The one is you definitely did have a urine infection 2 weeks ago. You had bacteria in your urine, which isn't a stone, OK? Yeah. A kidney stone tends to just give you blood in your urine. I have got blood in your urine, but you've also got white blood cells and you did have bugs, bacteria, OK? So the question for now is whether we treat you with antibiotics, whether you start them now or whether you want to wait and see what your symptoms do and wait for the result.
I could wait till Monday, just maybe take paracetamol.
I mean, I could give you the prescription in case it gets really bad over the weekend, but you don't take them unless it gets really bad.
I think that might be better.
I think what we might do, get you to have a scan of your kidneys, just to make sure that there's no underlying problem causing you to get recurrent infection.
We haven't really had a working toilet for a while, like a month.
You haven't had a working toilet? Have you survived without a toilet?
Just buckets.
Buckets?
Yeah, we just have to get the water and flush it.
Oh, I see. Oh, I see. So you're peeing and pooing in the toilet.
We only just got it fixed like a couple of days ago.
That's all right.
No, so it's not unsanitary.
No,
things.
that's not unsanitary. No, that's all right. That's OK. It's only the flush that's not real. I thought you were going in the garden or something.
No.
I know. OK, so just keep that and don't use it unless your symptoms get worse. Yeah?
Thank you.
OK. All right, any questions you want to ask me?
Just maybe cutting on my drinking. How would I cut down on my drinking?
Do you want to come back down and sit down for a minute? How much are you drinking?
I drink a lot, but I'm not drinking like 2 bottles of wine a night or something. It's just like the most I think is probably about 24, but that was about over like 4 days, 5 days. So.
24 what?
Pints.
Pints of what?
Beer.
Pints of beer. So you drink beer, that's pretty much all you drink. You don't drink wine or spirits?
No, like if I go out in town or whatever, I will, but I hardly go into town. It's just to the pub.
OK, so in a typical week, how many nights do you go to the pub?
I go on Wednesday, I'm going out tonight, and then probably end up going maybe Saturday or Sunday.
So sort of 3 or 4 nights a week in the pub?
Yeah.
Is that right?
Yeah.
And how many pints?
2 or 3.
2 or 3 pints?
On a...
3 or 4 times a week?
Yeah.
Healthy drinking is a really important part of our social fabric, and people need to enjoy alcohol, but enjoy it responsibly. If a teenager gets into the habit of drinking heavily, if they continue this into their older adulthood, this will lead to problems with their general health. So people need to think about their drinking habits and try and establish good drinking habits from early on. So that's 6 units. 6 also, so that's 24. So you are drinking more than the recommended amount at your basic, OK? Is it causing you any problems? Do you feel terrible in the mornings? Do you feel guilty about it? No violence between you and your girlfriend or anything like that? Do you think it's a problem?
Now I am, but before I didn't.
If you're recognising it as a problem, it's, from what I'm hearing from you, you can cut down. It's not out of control. You have some nights off. You have several nights off a week.
Like, I can cut down. It's just like things like parties and going to see my granddad.
Why don't you try and go to the pub slightly often? Why don't you talk to your granddad about him having something else in that isn't beer?
Yeah,
You go to your granddad and have a cup of tea? Sort of strategies like that, isn't it? Or just having shandies, or is that too...
No, I can drink shandies.
Yeah? Well, if you drink shandies, you halve your intake.
OK.
All right?
I could do that.
Is that all right?
Yeah, that's fine.
You come back and talk to me again if you want to.
OK.
Or Dr. Graham. OK? Is that OK? Yeah. There is services that we can offer to help you, but I'm not sure you need that right now.
OK.
OK?
Yeah.
Is that OK with you?
Yeah.
Yeah.
OK, thank you.
All right.
Good morning.
I've got an appointment at 10 too.
OK. Who are you seeing?
I don't know. My mum made me.
Oh, right, OK. Is it a doctor or a nurse, do you know?
I think a doctor.
Doctor. And your name is?
Francesca Clark.
OK, let's have a look. Yeah, it's the duty doctor, Dr. McLaren. Okay. Yeah, I've booked you in, so if you take a seat, I'll call you in.
Come in, have a seat.
Thank you.
What's been happening?
So I was just taking a drink and I felt it was like a bit weird when I swallowed.
Today?
No, this was a few days ago, but I only managed to get here today because I had to go down to Plymouth to take an exam.
Okay.
But it's just really swollen.
Okay.
And gross.
So 3 days ago, sore throat, swollen.
Yeah.
And gross.
Yeah.
Okay. How do you feel? Do you feel today? Do you feel like you got fever at all?
I don't think I have a fever. I just.
What's your finger in there? Are these from this summer?
No, they're from last summer. I've been really boring this year.
You and me both. I've not done much. 37.5.
I'm just going to Spain tomorrow or
yeah?
tonight. Yeah.
Nice.
So the rest of my family are already there.
Okay, head back on that. Oh yeah. Yeah, they are gross, aren't they? I think you might have a bit of an abscess going on there. It looks like it's possibly. I'm going to get the doctor to come and look at that because I've not seen one like that before. Okay. And I've looked at a lot of gross tonsils. Just going to ask Dr. Cordell to come and have a look.
So I've been documenting it. So that's it, like, last night.
Oh, right, okay.
Started.
Let me try and take a photo again for you.
Yeah.
I'm on pen touch and you've got another one. Especially if you're going away tomorrow. Deep breath in. Yes, you can't really see it very well, but it's this bit here that I'm worried about.
Poking out the back.
Hi, Lizzie. Sorry, I get you've been trying to get hold of me.
That's all right. OK, I just want you to look at this tonsil because I was just saying, I've looked at a million tonsils and I know what a bad one looks like, but I've not actually ever seen one that looks like this. To me, it looks like it's sort of like burst open or something.
Okie doke.
Doesn't look quite right. The only reason she's here is because she's going on holiday tomorrow to meet her parents in Spain, so that's why she's here.
It does look horrible, doesn't it? So we need to swab that.
OK.
OK. You get that appearance with bacterial tonsillitis. You can get that appearance with glandular fever, actually, but...
It's a bit swollen there. But not too sore.
Yeah, you have got a gland up there, haven't you? And then let's have you...
Deep breath in.
Wait for Lizzie to finish.
You are so good at this. Oh, my neck.
Brilliant, actually.
Oh, I just smell them.
Yeah, it does.
Yeah, so put penicillin, and then because you have got quite a big gland up here, actually, book an appointment to see us once you're back, and we'll just check that that's going down and your tonsils are looking lovely rather than manky. Okay. Is that all right? Does that
Yeah,
make
that's
sense?
fine,
You happy with that?
Yeah, that's great.
Super. Can I go?
Yeah.
In the middle of a cup of tea when you called me out urgently. So I'm going to return to my cup of tea.
OK.
OK, have a good holiday.
Thank you very much. OK, so I just need to get this signed. So if you have a seat in the waiting room, and I'll pass this back out to you. Have a good holiday.
Thank you.
Bye.
Morning, can I help? Do you know who you're seeing?
Dr. Barnett.
Dr. Barnett. And your name is?
Azalee Williams.
So it's the 15th of June.
What is it today?
It's the 7th.
OK.
Or is it the 8th? No, it's the 8th today. The 8th.
So it's the same time, but next week?
Next week, next Thursday.
Cool.
Thank you. We'll see you then.
Come on in. Hi.
Hi.
Who have you brought with you?
My old dear.
All right.
Lovely way to be.
Yeah. Hiya.
Hello.
So what's been going on then?
I just don't feel like myself. I feel like doing some stupid things.
Stupid things?
I feel depressed, sort of thing. Like, I don't feel normal. And it's been affecting everyone in the house. And yeah, I just need help, basically.
Yeah, I'm sure. Tell me a little bit more.
OK, so I don't know what to say. Like,
It's been going on since you were 15, really, hasn't it?
yeah.
OK.
Especially with the anger issues.
Yeah. So has anything changed? Has anything brought you down?
I feel like in my house, I'm just not wanted by anyone. I'm just on my own, sort of thing. I'm like everyone's against me. I try to control my anger. As Mum said about like getting some wood and about gardening, get some nails, and just every time you get angry, just beat up the wood with some nails.
Yeah.
But that didn't even work because I get too angry and I black out, and then I just ended up punching it with my fists.
I'm sorry to hear all of this.
I just think about things over and over again.
What sorts of things do you think about?
Mum like don't love me, my dad, sisters.
Are they the people that are at home with you? Who's at home? Yes, you're living at home at the moment. Yeah. And are those thoughts about feeling low, are they there all the time, or are they just there at certain points?
It's been there. It's there. Like, I do feel low. Something happened yesterday, and it's just completely, like, I didn't want to be here yesterday. I wanted to kill myself yesterday.
Right.
I didn't, like...
What happened yesterday?
I might just explain it.
It's not for me to explain.
Do you get a lot of stress and anxiety?
Yeah.
What sorts of things set that up?
Just school, life.
How do you feel about that?
Just down, just always want to be alone.
Would you like some help?
I'd like to say yeah, but a part of me said no.
Come on in, come and take a seat. Right. What's on your mind?
I'm really stressed out and I get anxiety a lot because sometimes I just feel like life is always going against me and that everything is going wrong and that I feel powerless because I can't change anything.
What year are you in?
7.
Year 7. And everything okay in your sort of friendship groups and things like that?
Yeah, friendship group's pretty good. It's just my home life, which is kind of like weird, I guess. Because I live with my mum and my stepdad and my sister and my autistic little brother, Dexter.
And how do you find him?
He's really nice, but he's quite hard to cope with sometimes because he's so high demanding.
Okay.
And I worry for like my mum and other people. And sometimes I feel like with their stress, they sort of don't mean to, but they bring it into the house. And people snap at each other.
Yeah. There's been quite a lot of things going on at home.
Really a lot, yeah.
And you've had quite a lot to deal with, haven't you? Because there have been health issues in the family, which is adding to all of this. And that's what I think we need to also explore, is how your response to all of these other issues that have been going on. In terms of when you say that you feel a bit low or a bit anxious, have you self-harmed in any way at all or anything like that?
No. But when I'm really, really upset and feel like I have no one to turn to, I think it's more the thought of disappearing and not being there rather than actually killing myself.
And what's been really great is the way you've told me your symptoms. You're actually very clear in how you're feeling, what you need help with, and what we're all here to do is help support you. So counselling at school would be really helpful because that's somebody who sees you regularly in your environment, you know, on a regular basis. I can see if we can get back into having a few sessions via CAMS, but it's getting increasingly hard to get referrals in. Leave that with me. You might find it helpful to just keep a diary, a journal, and just write down your thoughts. What's made you happy? What's made you sad? And what can you do about it? It just helps to clear the thoughts a bit. Does that make sense?
Yeah.
I'd like to see you back in a couple of weeks and see how that diary's going and how you're feeling.
That's cool. Thank you.
Good. Nice to see you, Archie.
Thank
Take
you.
care.
Thank you.
All right. Bye-bye for now.
I thought that went good.
She's so lovely.
I know.
What happened yesterday?
Yesterday, we had a major row.
I'm sorry that it's upsetting. Would you like a tissue?
Yeah, that's...
So, sometimes these things are really difficult to talk about, aren't they?
Yeah.
What, can you tell me more about what happened yesterday? You said that you didn't want to be here and that you were even thinking about harming or killing yourself.
Yeah, it's just that I tried talking to people and like people just shout at me, and then again anger comes out, and I don't like being angry.
Let's just start at the beginning in terms of the things to be worried about. You mentioned that you were feeling really bad yesterday, and you got to a stage of worrying about whether you wanted to harm yourself. You said even kill yourself.
Yeah.
Are they thoughts that you've been having that we need to take seriously, or was that just something that happened yesterday and it's? You know, tell me more about that side of things.
Well, I've tried it before.
You've tried it before?
I've tried overdosing, but obviously I hadn't got, I've took so many, and I've just eventually got drowsy and just dozed off.
Right.
So I just fell asleep, so I couldn't,
When was that?
Oh, it was a couple of months, a year ago, 2 years ago. Something like that, yeah.
But you didn't talk to anybody about that?
It's the first time I spoke to someone about everything.
And then, do you think that is that at risk of happening again?
If I get too low, then yeah.
If you got to that stage and you were making plans or you were actively wanting to die, then that becomes an emergency that you need to talk to the crisis team for, and there's a special number that you can talk to get hold of the emergency mental health team.
Okay.
I'm right in thinking that that's not what's needed now, though?
It's not got that far.
No.
It's not got to the point where I'm like...
Sure. Suicide is the biggest killer of people under the age of 35, and men are 3 times more likely to kill themselves. I think for all of us, it's a normal part of being a human being to wonder what we're doing here and to have existentialist ideas that mean that sometimes we wish we weren't. Of course, sometimes those feelings can spill over into being more serious suicidal thoughts. And if they do occur and are more deep-seated and pervasive, then it's really important that people go and see their doctor to start the ball rolling to get the support that they need. The crisis team, as I say, is the first number that I'm going to give you, and that's for if you get to a stage where you get that bad again. And there's also the Samaritans. I don't know if you've heard of them.
Yeah, I have.
They're a professional talking service. So for people who are feeling so alone that they need to talk to somebody, and that's what they're there for, 24 hours a day. Okay, so there's always options of people to talk to. Yeah. And as long as you're able to do that, then that is going to make me feel safe about letting you go home at this point. Okay. Is that okay from that emergency side of things? I'm going to give you some information about some counselling services that includes anger management courses and some CBT, which is about looking at new ways of thinking to try and help you move forwards with some of these issues. The most important thing is if you're feeling worried or you feel like you're not being safe, then please do something about it and talk to your mum about it, because obviously she's heard all this stuff and is going to be there to support you with this, and we'll move things forward step by step, all right? Cheers, then.
Thank you very much.
Nice to see you. OK, nice to see you.
Take care.
All right, any problems, you just let us
chair
know.
back.
That's fine, I'll sort it out in a minute.
Hello, can I help?
I cut my finger last night. I wondered if it's more of a doctor's job or maybe a small hospital job.
Can't do stitches here. Do you think it needs stitches?
Actually, I'm not a medical professional. Do you know anything about this?
No, I'm not medically trained either.
No.
I don't do blood, I don't train me.
OK, I won't get out then.
Do you want to pop into the treatment room? There's a reception in there, so the receptionist in there is probably more able to sort of to see whether you just need it dressed properly or whether you need to go to A&E.
That's great. Can I just walk
Oh,
in?
yeah, just go in, all right?
Come on in, have a seat. How are you doing?
I'm okay, yeah.
All right.
The British Wellbeing Therapy rung me.
Yes.
And said to talk to you about mood stabilisers.
So you saw them, I think since then you've had some one-to-one. Is that right, or you haven't yet?
I'm still on the list for the talking therapy.
Yeah.
But they can only help with the low moods. They can't help with the high moods.
Right. So in general, GPs don't initiate mood stabilisers. You go and see a psychiatrist or a mental health practitioner to have a fuller assessment to see whether there is a diagnosis that would mean that you would benefit from a mood stabiliser. Do you know what kinds of diagnoses they're thinking of?
They didn't really say.
And how much of the time do you think it is the low mood that's the issue?
It's kind of hard because if I'm... It's obviously like really, really low or it's really amazing, and when I get in that really good mood, I feel like I don't need any help at all, and I don't need anything.
Yeah.
But then when I go low, I think, why didn't I accept any help?
And when you feel absolutely fine, and you know better than fine, can you describe it a bit?
I'm either really irritable. I don't sleep. I feel like I have like 1,000 thoughts in my brain, but they're not like bad thoughts.
Yeah.
They're like really amazing thoughts, and I just feel really good about myself. I'm great, and I want to socialise constantly with people.
Okay.
Because normally I'm quite self-conscious. Like if I'm in a low mood, I'd be really self-conscious, have really low self-esteem.
And how often does that switch?
The low moods last longer, so they can last. They'll last longer than a week, so it'd be like more like 2 weeks. Sometimes I've had it like a month. And then the higher moods can last, I'd say, about 2 weeks as well.
Okay. And have you looked it up and thought about what this might be?
I was thinking maybe bipolar.
Okay. Well, what I suggest we do is I'll write a referral letter to the community mental health team to ask them to do an assessment to see whether they think you have got a diagnosis that would be suitable for you to go on a mood stabiliser, as the Bristol Wellbeing Therapy Service have suggested. And I think whilst you're waiting for that appointment, it would be a good idea for you to write a diary of how your moods are, because it's quite useful, I think, for them to see how much it fluctuates.
Yeah.
Okay?
Yeah.
And you could also write down some of the thoughts you've got, okay?
Okay.
Whether they be low thoughts or high thoughts, yeah? And then that will give them a really good picture when you go to see them, okay?
Yeah.
You know, it may well be that both you and the Bristol Wellbeing Therapy Service are right and that you would benefit from a mood stabiliser. What are your views about going on a medication?
I've always been really against it, but I think recently when I've been in a low mood, I've sort of been like, it's not a way to live. Like, if I could help myself to just be stable, then I would prefer that.
Yeah, okay. So, so I'll get on with that.
Okay, thank you very much.
That's all right. Bye-bye now.
Bye.
I got an appointment at 4:15.
4:15?
Yeah.
Oh my God, that's actually hilarious.
Right, fall, accidental. Fell off bike yesterday. Large wound on the right above your hip. Right, let's have a look at your back then. So it's your back that she was worried about.
Well, yeah, because it's quite...
Nice little what they call a screech in Bristol.
Yeah.
Have her stand up, come over here for me.
I just didn't know what to do with it, because I thought, well, we kept it open yesterday, then
It's got a bit of grit, a little bit of grit in there, hasn't it? OK. So we need to put some dressings on that. Yeah. So it's just this one that needs dressing, no others anywhere?
No.
Just that.
OK. So what were you doing?
On a bike.
What kind of bike?
BMX. It just broke.
It broke?
Yeah.
Yeah, well, we think, no, it's a genuine...
So you didn't fall off it?
Well, I fell after it.
Yeah, the brake jammed and he went flying over there.
Right, come and have a lie on here for me. Just lie on your left side. Don't worry, I have to do the same. There we go. Right, I'm just going to give it a clean. Lean right over for me. Lean right over, that's it. You all right?
Yeah.
So, tell me why you should wear a helmet.
So I don't hit my head.
Things like this are easy to fix. Broken arms are easy to fix. Broken heads aren't easy to fix. And your head is actually surprisingly delicate. Right, that looks pretty clean now, actually. It's like this magical silicone dressing, and it basically just keeps it moist and stops the air getting to the top area of the damaged skin, so that then the skin heals from underneath upwards.
Help with this.
Yeah, are you able to just pull them down for me slightly? Trying to get this so that it covers the whole thing. This is going to look far more dramatic than it is, isn't it? People will be thinking you've, like, ripped yourself open or something. Right, and then we'll put a waterproof one over that so that you can have a shower. And this bit. Keep an eye on this patch here. So this should stay looking relatively clean. If you start feeling unwell in any way, or it starts feeling hot or anything like that, any signs of infection, come back straight away, don't wait. But otherwise, leave this on for a week, come back, we'll take it off, see how it's doing, and then probably put a new one on again. There you go.
Sure.
Sorted.
Cheers.
Yeah, does it feel all right?
All right. Cheers.
Lovely. Thank you very much.
See you later.
Bye.
Have a good day.
Hi, have a seat. Hi. Right, what can I do for you?
Basically, I flew home this morning from Spain.
Right.
I come in about 12, and all I can remember was I stood up and I completely blacked out, and my mum said I, like, collapsed on the floor, smashed my head on the patio thing, and I don't remember falling. I just remember, like, waking up, like, 2 minutes after, and she was like, am I all right?
OK. So that was 12 lunchtime today?
That was kind of when, no, it probably would have been more around 2 o'clock that it actually happened.
OK, and how have you been? You've been in Spain, yeah? And have you been eating and drinking normally?
I ate on the plane.
Yeah.
And I've drank, yeah. So,
yeah. Fine, OK. And have you drunk much alcohol when you've been away?
I drank about 3 nights in the 12 days, not like every day or nothing like
Right,
that.
OK. And did you have much last night?
I didn't drink last night.
No, OK. Have you used any drugs or anything? No, OK. Fine. Can we have a little look at you? Is that OK? So I'll just check your temperature. That's OK. Can I pop this on? Well, that's going up. I'll have a little listen to your heart and your chest, if that's OK.
I feel like my heart's beating really fast as well.
Do you? OK. Just a little feel of your pulse. OK, it's beating a bit fast, actually. And how long's that been for?
Since I dropped.
Right. Just have a little listen to your heart. OK. What I'd like to do is get you to stand up, wait a minute, and then repeat your blood pressure with you standing, if that's OK. All right, so if you stand up. OK, that's OK.
I sit back down now?
Yeah. OK. Your heart rate is still quite fast. So what I'd like to do is get an ECG, a heart tracing. So if you go and have a seat in the waiting room, I'll ask one of the nurses to do that for me, and then we'll review the ECG and see where we'll go from there.
Really
Please
strict
do not make or receive phone calls.
Good morning, Corporate Health Centre. Sally speaking. Hello, can I help? Good morning, Corporate Health Centre. Good morning. Right. Oh, God. Courtney. I think the phones have gone down. Can you check?
Mike, I'm just in the doctor's surgery.
Because there's loads of pus in it, Pat. It's massive.
I'm going to get called into the doctor's any minute now.
It needs to just get squirted out and that's it.
Oh, we should be back. Wonderful.
I'm Dr. Jewell. Hello.
Hi, nice to meet you.
What can I do for you?
During December, I had a really bad acne, so doctors prescribed me with this solution, and I've run out, so basically I needed more.
Okay. Did it work? Does it do the trick?
Yeah.
So you're happy with that?
Yeah.
And all you want is for me to re-prescribe
Yeah.
it? Okay. Somebody's looking after your diabetes, and is it well controlled and you're on top of it and
Yeah.
you know what to do? How long have you had that for?
I think since year 9, so around about 2012.
You cope with the restrictions and everything?
Kind of.
You have to live with it. You have to live with it as best you can. So what about the PCOS?
The doctors weren't sure if I was being diagnosed with it or not because they were unclear during my scans. And then they didn't really say much about it after that, so I just stopped. So I just assumed that I don't have it.
But unfortunately, they think you have.
Yeah.
Do you understand what it is?
Not really.
No, neither do I.
I kind of have a...
Nobody knows what it is. We know some of the effects of it, but nobody knows quite what the underlying problem is for PCOS. It contributes maybe to you being a bit overweight, which makes the diabetes more troublesome, I guess. And it makes your periods be a bit irregular. Now, we don't mind your periods being irregular and scanty. Do you?
Not really, no.
Good. It's associated with a problem of fertility.
Oh, yeah, I kind of had an idea of that.
So do you have any feelings about that?
Kind of. Well, not now, obviously, but... yeah, I do.
No, but I mean, it might be something that you worry about in the future. There's no way of telling you whether that's one of the effects for you or not. The only way you find out whether you're fertile or not is by trying to conceive. And you're obviously not doing that for the moment. You don't do anything until you either get pregnant. Until you get pregnant, it's great, or until you say, look, I'm struggling to get pregnant. Up till that time, you just let it go. So that was easy. I don't have to do anything to prescribe you some stuff for your face. Is that all right?
Yeah, that was basically it.
Okay, how are you feeling now?
Still the same.
Still feel the same. Let's just see what your oxygen levels are as well. Your ECG looks okay. It's a little bit fast, but not as fast as it was. And are you normally quite fit and active? Do you do any sports at all?
No, not really, but I do like weights and that.
Right. I think the most likely cause is a faint, to be honest. Okay. But I would have thought you should have recovered by now, okay, because we're about 4 or 5 hours later. So I'm a little bit concerned because you've had a flight and you feel unwell with it and your heart is racing, okay. So what I think we need to do is ask the hospital to see you just to check there's no sign of a clot in the lungs. I think it's unlikely, but I don't want to miss it. So if you make your way to Ward 31B, they'll assess you further, okay, and just to be absolutely sure there's no clot there.
Right,
okay.
Thank you.
All right.
Thank you.
Okay, no problem. Bye-bye.
Right, Oliver, insect bite. Where's that then?
On the side of my leg.
This looks serious. When did this happen?
It happened a couple of days ago.
Right, where were you?
Ooh. I can't remember.
So when did you notice it? When you were at home later?
Yeah, when we got back from Greece.
Ah, you've been on holiday? Can we pop you on that bed there and then I can have a proper look at it? have a look. So is it painful?
Yeah, stings.
So what's all this dry patch around here? Is this just crust from where it's been weeping a bit?
Yeah, probably.
Okay, let me get some gloves. It's a bit hard, isn't it? So it doesn't look infected at all. It's quite a nasty reaction. I think we just need to put a good dressing on that and just let it heal. Have you been scratching at it?
I was scratching it a little bit and then I stopped because it started stinging.
Yeah. If you scratch it and break the skin, then you get bacteria in from all underneath your fingers into the skin, and you can end up with a nasty swelling all the way up your leg, and that's what we call cellulitis, and then you end up having to have antibiotics for that. Just give it a clean. What you want to keep an eye out for is if it starts spreading really far down, or if you start getting lines tracking up his leg or anything like that. If it starts getting really hot or his leg's actually swollen. Sorry. Have a look at it on Friday yourself. And if it looks pretty much the same, just change the dressing. I'll give you a couple. Just change the dressing, and then either way I would come back on Monday and see the nurses just to get it properly checked. So this is bright yellow, so you might see this coming through the dressing, so don't worry too much. If this does start irritating him for any reason, just take it straight off and just pop the plain dry dressing on. There we go. So you need to keep it clean and dry. So don't go jumping in the bath or in the shower with this, all right? So if you need to have a shower or a bath, you're gonna have to do it like that. Do your leg out the bath, all right? Some Calpol if it's sore. If it's hot, swollen, painful, outside of that dressing, bring him straight back. Thank you. You're welcome. I'll see you later.
Bye.